All right, well, we've all heard of varicose veins, and of course those are the enlarged veins that usually occur just under the skin and can be caused by one or more factors. Having varicose veins or chronic venous insufficiency, known as CVI, can be a sign of a more serious problem that may need treatment.
Joining us now, our board certified general surgeon, Dr. Garrett Peel, to walk us through some of the different forms of vein surgeries that are available and address who could actually benefit from some of these various procedures. Doctor, good morning.
Good morning.
Good to have you in.
Good to be here.
It is. All right, let's start off talking about vein fit. What is that?
Well, vein fit is a procedure that is done right in the comfort of an office.
Oh, wow.
And the reason why we do this is because patients present with painful, swollen, edematous legs. And in fact, insufficiency is an epidemic in our country. People just don't realize there's a treatment for it. So it's an innovative treatment using radio frequency waves to close down the vein that doesn't work so that the pressure can be taken off of the lower portion of the leg so that varicosities don't get worse, spider veins don't develop or get worse, and or chronic wounds can heal.
So it's not so that they don't get worse, but does it actually take away the vein? I mean,
It does. It actually takes away the bad vein and recirculates the blood to the veins that do work. And that's basically the whole premise of how varicose veins are formed. You can see that.
Yeah, that's lovely.
And unfortunately, there's many patients that present to my office like this.
Sure.
Yeah, it looks painful, doesn't
A
it?
lifetime of painful, swelling legs. And it really limits what you can do. Some people can't exercise, they can't go to the mall, they can't travel long distances in a car because of their painful, swollen, edematous legs. And it's amazing. Once we do the procedure that takes about 10 minutes, okay, with just minimal anesthesia, these folks are doing very well afterwards. And all of those varicosities have no more pressure, so they start to kind of shrink down.
Yeah, it's not just a cosmetic thing. I mean, it's painful for them.
It is. It's a real medical condition.
Now, I know in the past they had the vein stripping, which just sounded really painful.
Sure.
And then they've done the injections, which can be painful as well. But this one, does it have pain with it?
There is some discomfort, but certainly vein stripping was our only alternative before this newer technology came to be. And that required general anesthesia, sometimes a hospital stay, because essentially you were taking the vein and stripping it out of the leg, somewhat barbaric. The new way is to essentially make a tiny incision so I can get a catheter and a wire in and close down that vein with radio frequency waves.
Okay,
now,
so this is going in under
this is actually going into the vein itself under ultrasound guidance, and you can see that the normal vein has a good valve that works, and the blood flow basically takes that blood up to the heart and the lungs. When there's a varicose vein or when you have venous insufficiency, the valves fail and the blood goes the opposite direction, causing hypertension of that venous system. It's almost like when you have hypertension, your heart gets larger. The same concept here in the legs. When you have hypertension, your veins get larger. And then when those veins get larger, they start to pull fluid, and then you have swollen legs with activity, and it can really be a cumbersome thing for many people. But the point is that if we can get to the root of the problem by fixing the insufficiency, then the spider veins can heal, and or we can target the spider veins with potentially a laser technology or an injection, and then we get to the root of the problem. So usually those spider veins will go away forever. So many people come to my office and say, look, I had this injected 2 years ago, but they're right back. And then we do our workup, and sure enough, they have insufficiency. We fix the insufficiency, they feel better, the legs are healthier, we get the legs in good fit, and then the spider veins never come back.
That's pretty good. And immediate relief, but how soon before you can resume normal activities, walking, even
Some
jogging,
people come to my office at lunchtime and go back to
run out.
work.
Really?
That's right. That's right.
Okay, and I have a question about, what about people that are really nervous? I mean, it's a local injection, but you give them something to kind of calm the nerves before they go in?
We do if the patient requests it, but we are very efficient there at Previty and compassionate, and with a few pokes, everything's done. So I fashion it better than going to the dentist. It really is a comfortable procedure for most people.
Now, I know some women who have to wear those compression hoses because of these problems. You can actually throw those out the window after this, right?
Well, usually patients that have this procedure have had to wear them before, so that we can make sure that they have what we call failed conservative therapy. So elevation, exercise, compression for greater than 6 months. And usually venous insufficiency can be treated with those conservative measures. However, most of the time with advanced disease, they require this procedure.
Nope.
And usually the compression hose are thrown out the back door.
Lots of good talking about this, but are there any complications, anything that they need to be worried about with the procedure?
Anytime we do surgery, there's always a risk of pain and potentially an infection, though that's very rare. There's also a small risk of developing a blood clot, especially in patients who have developed blood clots before and or patients who have blood clotting problems that they don't know of, a genetic trait in their blood. That is incredibly rare though.
Yeah.
And what about insurance? Does it cover it?
Insurance, Medicare, Medicaid cover this because
Very
this is a
nice.
serious medical
Yeah.
condition, and it is covered by almost every insurance company that we have in our country.
That's great news.
Yeah, get rid of the pain, walk freely, get back to work,
That's
whatever you
right.
need to do.
And look a little better all at the same time.
Get your legs fit and get your health better.
That's good
Right, I
stuff.
like it.
Thank you, Dr. Peel.
Thank you so much.
Coming up.